Welcome back to our Mental Health Matters. I hope you all are doing well. So in today's video, we'll be talking about signs of depression that you probably didn't know about. So I'm going to be talking about signs of depression, but I'm going to split it into three different aspects. So we'll be looking at depression, we'll be looking at some of the signs, physical signs of depression, we'll look at the psychological signs of depression, as well as social signs of depression. So if you want to see this video, make sure that you watch it to the end. Yes guys, most of the signs that I've got today, you'll be probably shocked. You probably didn't know that depression can do this to you. So make sure that you watch the whole of the video, okay? And click the subscribe button as well. Come on, click it, click it. Right, click the subscribe button and hit the notification bell as well, so when I upload, you'll be one of the first people to be notified. So right, with no further ado, depression, obviously I've talked about depression before, what depression is and all that. So in this video, I'm just going to be talking about the signs. If you want to know what depression is, watch my video. I'll link it in the description box, so go and click it and watch that one. It will tell you a little bit more about depression, what it is and how it affects our lives. So make sure that you click that video. So signs of depression. So we look at depression from the physical aspects of things. What are the physical aspects of signs of depression? So one is changes in appetite. Depression can actually change your appetite. It can make you eat too much or too less, or it can make you not eat at all, whereby you don't have appetite to eat at all. Depression can affect your sex drive. It can affect your libido, whereby you don't have sex drive. You don't feel like having sex. Or you don't feel like having sex. That's one way that depression can affect you as well. Another physical sign of depression is feelings of nausea, and also depression can affect your gut. There's a link between your gut and your mood. So if you're depressed, if you're feeling depressed, one of the signs that you'll feel is bloating. You'll feel bloating, cramps. You can feel stomach pains as well. And also depression can cause pains. It can cause headaches as well for you. These are some of the physical signs of depression. And one shocking one is it can affect your menstrual cycle. So that's another way that depression can affect you physically. So it can also, it can affect it. It can change your menstrual cycle. So those are some of the ways that depression can affect you. It can also make you feel nausea as well. And you can also have sleep problems, whereby you're sleeping too much or you're sleeping too less, or you're finding it difficult to fall asleep and to stay asleep, whichever way. It can affect you in that way. So we move over to the psychological signs of depression. So first and foremost, depression can affect you by obviously low mood. Your mood becomes consistently low for over 2 weeks. You find that your mood is low, consistently depressed mood. And also depression can make you have feelings of hopelessness, feelings of guilt. It can make you feel worthless. It can also make you can lower your self-esteem as well. Depression can also make you lack motivation, whereby you don't have motivation to do everyday tasks such as washing your body, washing yourself, showering your hair, even cooking or doing things like that. Also, depression can cause anhedonia. Anhedonia is just lack of pleasure in things that you do, in daily activities that you do. These are some of the ways that depression can affect you. And socially, depression can affect you by making you to avoid social contacts. You can avoid families. You can sorry guys, I'm gonna bite my tongue. You can avoid contacts with family. You can avoid contacts with friends. You want to isolate yourself. You move yourself away from crowd, from people, from from social gatherings and things like that. Depression can also make you not want to engage in your hobbies or in things that interest you. You don't find motivation to engage in your hobbies or things that interest you. You can also have difficulty in your home life. You can have difficulty in work, in your social skills, like going out, doing things. That's one of the ways that depression can affect your social life. The way it can affect your social skills. So one thing I want you to know, why I'm doing this video, is just so that if you find yourself experiencing any of these signs and symptoms, I'm not here to diagnose anybody, but if you find yourself experiencing any of these symptoms, maybe it's time to ask for help. Some of the signs of depression, you have to have experienced it continuously, consistently for 2 weeks. For it to be diagnosed. So maybe it's time to speak to your therapist, it's time to speak to your doctor, or to speak to someone that can help you make sense of some of these feelings that you're having some of these signs that you're experiencing. That's why I'm doing this video. Depression is a common mental health problem, and studies have shown that 1 in 5 women would suffer from depression at some point in their life, and 1 in 10 men would suffer from depression at some point in their life. So you're not alone if you're going through depression. The good news is it's treatable. There are so many things you can do to manage depression. But one thing I want to kind of bring to your knowledge is, according to DSM-5, DSM is Diagnostic Statistical Manual for Mental Disorder. So this is like a guide that psychiatrists, doctors use to diagnose mental disorders. So for depression, I'm going to actually read it out. I'll read it out to you guys. So this is what the DSM-5, which was actually DSM-5 was updated in 2013. Yes, it was updated in 2013, so it's been like 7 years plus now. So it's the DSM-5. So I'm going to kind of read out to you guys some of the signs and symptoms of depression that DSM that they go for. So some of the signs are depressed mood. So you have depressed mood consistently for 2 weeks, and also lack of interest or pleasure in activities, which I mentioned earlier on is known as anhedonia. So it's lack of interest or pleasure in activities that you probably usually used to enjoy. Significant weight changes and appetite problems. So you find that your weight is fluctuating, whereby is because of your appetite. Obviously your weight, you can either be putting on too much weight or you'll be losing too much weight. So sleep problems, like I said already, you can have problems with sleep. You find it difficult to fall asleep, and you find it difficult to stay asleep, or sometimes your sleep is so erratic, it's everywhere and all that. And feelings of fatigue or loss of energy, concentration problems, feelings of hopelessness, psychomotor agitation and retardation. Also recurrent suicidal ideations, so whereby you're feeling like you want to take your life, you want to take your own life. So these are some of the signs that was listed in the DSM-5, and apparently if you experience some of these signs and symptoms consistently for 2 weeks, then it's time for you to start speaking to someone about it. Please don't feel alone. Depression, like I said, happens to a lot of people. It's a common mental health problem. So please speak to someone that can help you to make sense of everything that you're going through. So guys, I will leave you to it, and in my next video, keep living life, keep enjoying life, and keep loving yourself. I'll see you guys very, very soon. So see ya, bye.